When you are present, you will be there. Right?
Yeah, I'm standing there only behind you.
Then we will go when means.
When you come into that response.
Hello
I can't
everyone,
see the slides that
this
way.
is Jaidev Sanghvi, Executive Director at Aarvi Encon. Today is an important event for all of us. Just to give a background to start with what we are talking about. Once Mr. X walks into the office at 9:30 a.m. in the morning, and he collapses. He has a heart attack, and do you know what you are supposed to do? So we've got answers no. We've got a panel of doctors who have come here. I would like to introduce Dr. Sonal Shah, a great friend. We know each other for last 25 years, but professionally she is an MD anesthesiology, working, giving consulting at major hospital in South Bombay. First thing which I would do if any one of people are down, if any one of the people are down, then the first call for me is to Sonal. So I'm handing over this mic to her to introduce the team.
Hi, Aarvi family. I'm Dr. Sonal Shah. I'm an anesthesiologist. The other team is Dr. Tasneem Dhansura. She's the head of the department at Saifi Hospital. She has done she's been with the Indian Resuscitation Council since 2014. She'll be heading the session. The other teams are Dr. Gauravi and Dr. Sajan. They are our residents at Saifi Hospital. And we have Meenal Chikle, who is a perfusionist since the last 14 years. So, as you all know, anesthesiologists are peri-op physicians. We care for y'all when y'all are not aware. Part of our education includes expertise in airway management and CPR. Dr. Tasneem will be heading the session to continue with the rest of the program.
Before we start, we would like to thank with a bouquet or a pot of flower. Yeah.
Thank you so much. Thank you.
Thank you very much. Yes, over to you, ma'am.
Thank you so much. Thank you so much, and I'm so happy that we have so many people here today to learn about cardiopulmonary resuscitation. That's what we are going to learn about today. So before we begin what cardiopulmonary resuscitation is, we'd like you to understand what we are going to be doing today. So we're going to begin with some small videos for you to understand when CPR is actually given, what a cardiac arrest is all about. Slides. Okay, so we're going to run the first video. You will see that they are very young boys. They could be anybody playing cricket. Watching for that boy in the black shirt.
पहले का बॉल नो स्कोर बढ़ता हुआ 41 दो रन अभी पे क्लियर करो स्कोर बॉल बॉल
He suddenly collapsed. It's a young boy, must be in his 25s or 30s, playing cricket. Could be absolutely anybody. But unfortunately, nobody really knows what really needs to be done immediately once he is home. We go on to another video. So we had this gentleman playing badminton. This happened in Dubai. Unfortunately, nobody knew what to do with him. The same scenario. They just carried him from there to the hospital without giving him any cardiopulmonary resuscitation, and he did not make it. He did not survive by the time they reached the hospital. So there are multiple videos like this. You must have seen multiple videos like this roaming around on YouTube or on your WhatsApp. Young people in gyms, young people everywhere who are suddenly collapsing. Young, old, it can happen to anybody. We've seen even our famous singer, KK, who actually unfortunately had a similar episode. Again, he was rushed to the hospital, but he did not make it. So what we try to bring out over here is that we need to educate people more than only doctors knowing what needs to be done, because this is technically a community issue. This actually happens more, about 90% of the cardiac arrests are happening outside the hospital. They're happening outside the hospital. It's where the rest of the people are there. And our aim is to make sure, the Indian Resuscitation Council, that lots and lots of people learn how to give CPR so that the victims arrive in a state in the hospital where the doctors can do something, right? So we're going to go through all these steps over here to make you understand what's going to happen. Okay, so what does the heart technically do for us? What does the heart actually do for us? We all know that it's just a muscular organ which keeps pumping blood. That's all that the heart does. It's situated right here close to the chest, very close to the chest. It's right in the center of your chest. All it does is keeps pumping right from the time that you're in your parents' womb, in your mom's womb, till you actually die. Okay? So all your life long, it's continuously pumping. So when we talk about a cardiac arrest, what's actually happening to the heart? There are two things that can happen to the heart. Either the heart completely stops beating, right? Or the heart works by an electrical rhythm. You're aware of that, right? That's what we record as a cardiogram normally. So the heart works as an electrical rhythm. It works on an electrical rhythm. And if this rhythm becomes asynchronous, you require that rhythm to be continuously happening in one fashion so that the heart can pump continuously in a fashion where the blood can get pumped to the rest of the body. If this rhythm becomes asynchronous, the heart has still got an electrical activity, but it is not pumping the way it's supposed to pump, and that's why blood is not getting circulated. So about 70 to 80% of the cardiac arrest, especially in young people, is because of this rhythm, which is not very continuous. So the idea is to start CPR as well as use something known as a shock box, which we will show all of you how to use it. It's an AED. If you've been to the airports and all, you will see what an AED is. Today, we'll all learn how to use that. And that will help set that rhythm back again. So it gives a current, and you can set that electrical rhythm back again. So resuscitation means actually bringing back to life. So what we're trying to do is teach you how to bring that victim back to life, because we have a small window of period where the victim is not yet dead. Okay? He's had a cardiac arrest, he or she's had a cardiac arrest, but the victim is not really dead. People around can actually help that victim and bring that victim back to life by doing a resuscitation. So what we're going to do today is basically teach you how to do CPR. We've learned why you need to do CPR because of all these arrests that we've had. And we're going to teach why you're going to give CPR and basically how to give CPR on these mannequins that we have over here, where the people over here can actually learn it live. So basically, like I told you, it takes an entire society to, help us, help the doctors. It's not possible to get a victim to the hospital and then expect everything to happen. So like I told you, 90% of the cardiac arrests are happening outside the hospitals, right? They're probably happening at your home. 80 to 90% of the cardiac arrests are happening to somebody that you really care about. It could be a family member. It could be a parent. It could be a sibling. It could be somebody, a co-worker of yours. It could be a friend. That's the reason why we expect the society to learn how to actually give CPR. Next slide. Next slide. Okay, so we are going to train your hands to save lives today, and we're going to show you a small little video, basically, what happens when you give CPR, right? So just go through this video, and then we'll go ahead to actually show you how to do it.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
Okay, so what happened was all these years we've been using guidelines from other countries. Finally, the Indian Resuscitation Council was actually formed and guidelines for the Indian population were actually created, right? And that's when we started propagating this and teaching more and more people how to start training lives within the community and within the resources that are possible in our country. All right, so we came upon this compression only life support. Of course, the American Heart Association also has this as the hands only life support, and this is known as compression only life support, where the compressions that you just saw on the video is actually going to help you to keep that blood circulating so that the victims can get complete blood supply going to their brain, and that's what's the most important organ. So there are 3 core links that we need to learn. That is about early recognition, recognizing a cardiac arrest, and that's what you saw in those videos. Recognizing a cardiac arrest, making sure that the victim who has fallen down is actually having a cardiac arrest, and early activation of a system that we're going to talk about right now. Early cardiac compressions, which you're going to learn on these mannequins and we're going to show it to you also. And of course, an early transfer to a hospital as soon as possible and creating the entire system. So there's an entire algorithm that we are going to teach you today, and we are going to learn that. And if everybody learns this algorithm, it'll be easier for us to help people when there is some victim who's having a cardiac arrest as well. So most important thing is to ensure that the area is going to be absolutely safe wherever you're having a victim who's had a cardiac arrest. So you could possibly be in the middle of a fire, a building that's broken down. You could be in the middle of the road, in the middle of an accident, but ensure that you are safe first before you try to help another victim. Next slide. Next slide. Okay. And then the next most important thing is you're going to tap on the victim's shoulders and ask them, are you okay? So we're going to have Dr. Sajan and Dr. Gauravi showing you what you're actually going to do. You're going to kneel on the side of the victim and you're going to tap on the shoulders and ask loudly, are you okay?
Are you okay? Are you okay, sir? Are you okay? Are you okay?
Okay, so you need to do this on both the shoulders because you're not sure, you don't know the victim. It's possible that you don't know who the victim is, whether the victim can hear by one ear, not hear by one ear, whether the victim is paralyzed on one side, can feel or not feel, and that's the reason why we need to do this on both the shoulders. Once again, Gauravi, Sajan.
Sir, are you okay? Are you okay? Are you okay, sir?
Okay, so you can do it in whatever regional language that you're in. It necessarily doesn't have to be in English. It can be in Hindi or whatever language that you are familiar with. So you're going to get two kinds of responses. The victim is only going to wake up and tell you, yes, I'm fine. I only fell down. I don't know why I fell down. Or the victim is not going to respond to you at all. Okay, so if the victim is going to be responsive to you, then you're going to do one simple thing. You're going to observe this victim at all points of time. Make sure that the victim is continuing to talk to you, communicate with you. You're going to ask for help, ask the victim what the name is, and make sure that the victim is fine till some medical help arrives or you're able to move this victim out. It is possible that this victim will not be responsive to you at all. Meenal, slide. It is possible that this victim is not going to be responsive to you, and at that time you're going to activate the system that we are going to talk about. All right? So what you're going to do is you're going to call for help. What are you going to call? So there is a national number, 108, like how you call 100 for the police. You call 108, and that's a national disaster number that's available all over the country. And they will ask you a few questions which you need to actually reply and let them know where you are, where you're located, how many victims are going to be there, are you, how many people are there, how many rescuers are there. So you give them all this information. You will hang up only when they tell you that, okay, we have all the information. Otherwise, you made the call, but you're in a hurry. If you keep the phone down, they don't know where to come, right? So you're going to do that. You're going to make sure that you will hang up only when they have assured that they have got all the information. As soon as you hang up, you're going to start chest compressions. Once you have tapped on the shoulders and you have assured that the victim is not responding to you, you will also do two other very important things. That is, check whether the victim is breathing. Okay? So normally when you see any victim, anybody, when they breathe, normally the stomach is moving up and down. So you're going to see from the side whether the stomach is moving up and down. You're going to put 2 fingers under the nose. If all of you all actually do it, put 2 fingers under your nose, you'll be able to feel your breath. Okay? So you feel whether the victim is actually breathing. You see whether the victim's abdomen, the tummy is moving up and down with normal respiration. You can even place your hand on the victim's tummy to make sure that the victim is breathing normally. If you're not going to get any response from the victim, if there is no breathing, you are going to assume that this is a cardiac arrest until and unless proved otherwise. Okay? So this is a cardiac arrest situation. What you're going to do is call for help, and we are going to start chest compressions now. Fine? So where exactly do we give chest compressions? Hold the mannequin up. You're going to give chest compressions where your breastbone will end and where the soft part of your tummy will begin. So if all of you all can do it on your chest, you can make out where your breastbone ends and the soft part of your tummy begins, right? You're going to go 2 fingers above that. You're going to go 2 fingers above that, and that is the spot where we are going to start giving the compressions. Now, how do we start giving the compressions? We are going to use the heel of our hands. We're going to use the heel of your hand. We're going to have a hand completely straight, elbows absolutely out, fingers open, and we are going to interlock our fingers. All of you all can do that. Open up your hands. Everybody open up your hands. Elbows absolutely straight. Elbows absolutely straight and hands interlocked. It can be right hand over left hand over right hand, however you are, whatever it is, however comfortable you are. And you're going to go to that spot that you've identified, 2 fingers above the lowest point of your breastbone, and you're going to start giving compressions. 1 and 2 and 3 and 4, and you're going to keep giving these compressions. Okay, so you're not going to stop at 30, of course. You're going to keep giving these compressions till the victim gets resuscitated. So how do we need to give these compressions? What is the right technique that we need to understand how to give these compressions? So we need to give it at a rate of 100 to 120 per minute. That means every second you actually need to give 2 compressions minimum, so that you're able to get in between that 100 to 120 compressions. You're supposed to give it at a depth of 5 to 6 centimeters. What's a depth of 5 to 6 centimeters? You go back home, measure your fingers. One of them is going to be 5 centimeters, one of them might be 6 centimeters. So that's the depth that you need to achieve. And why do we need to achieve this depth? Is because your heart is at the center of your chest, between your breastbone and your spine behind. And we're going to use both these hard surfaces, the breastbone and the spine, and we're going to keep compressing the heart in between so that the blood flow continues throughout your body. And the main organ that we need to keep alive here is going to be the brain. All right? And we need to understand that it's a myth that the heart is on the left. The heart is actually in the center. God has made us like that, and that's the reason why we can actually save people by compressing the sternum, that's the breastbone, by giving compressions like this. Okay, so most important thing is how to give the compressions, a rate of 100 to 120 per minute. We're going to give a depth of about 5 to 6 centimeters. We're going to allow good recoil of the chest. That means don't lean on the victim completely. With every compression, make sure that the hand goes off. As you saw in that video that we showed you, you need to get your hands up. You need to let the chest expand again so that the blood flow can come back to the heart. And in the next compression, the blood flow can go back to the brain and the rest of the body. Okay? So you make sure that you keep doing this repeatedly till you get a response. Every 2 minutes, you're going to tap on the shoulders and you're going to ask, are you okay? The victim might start breathing, the victim will start moving, and you're going to keep doing this till help arrives. Remember, you made a phone call. There's going to be somebody who's going to come and help you. So you're going to keep counting 1, 2, 3, 4 like that, as they gave the compression 1 and 2 and 3 and 4, 30, 30, 30, 30, about 5 times. And data shows us that you're able to give about 100 to 120 compressions per minute. When you actually do this, you will realize that it is not a very easy task. It is difficult. It's a tiresome process to give it. And that's the reason why we need to train more and more hands so that more and more people can help us save these victims. Because you need to keep doing this till help arrives, or even during transport while you're shifting this victim to a hospital. Fine. Eventually, then you're going to keep tapping and keep doing this process over and over again. If the victim responds to you, you're going to turn the victim. You're going to put the victim in what we call as the recovery position. You're going to keep observing the victim and looking and talking to the victim, or move the victim to a medical center to find out what had happened and to take it forward from there. So now, how long will we keep giving cardiac massage? We need to keep doing this till help arrives. Like I told you, an ambulance will come with the equipment and somebody to help you. Or till any other trained rescuer. You know, there are paramedics who are trained how to give chest compression, so you can help and go ahead with a trained rescuer to keep giving this. Of course, if the victim had not fallen in front of you and you had been called, okay, this person has been unresponsive, if that what we call as rigor mortis has set in, that is, if the body has already become cold and very stiff, it's not going to be helpful anymore. All right? So this process of giving cardiac compressions is very, very useful, especially if it is a witnessed arrest. In front of you, if the victim has fallen down, it's going to be something which is going to be very, very useful for you. So like I told you, once you have done this, as soon as the help arrives, you're called for help, you're going to call people around you and you're going to make a phone call. And an AED, that is known as a shock box, If that is available to you, you need to learn how to use it. And we're going to show it to you today, how we're going to use an AED. So what you can see on your display right now is an AED. It's something very, very simple and can be used. Okay, it's a small box. It might be red in color like this. It might be, there are only 2 or 3 or 4 companies worldwide that actually make these shock boxes. And it'll be a red, bright red color that you can see over there. Okay? And it has only 3 buttons on it. Everything will have 1, 2, and 3 number labeled. All you need to do is know the sequence of events and use it in the proper way that it's supposed to be used. So we'll run some videos for you. Have a look at those videos, and then we'll show you a demonstration of the AED.
Arise.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel 1 pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Evaluating heart rhythm.
Stop compression, Susan. Stand back.
Stand by.
Stand clear, everyone.
Shock. Everyone clear. Do not touch patient.
Stand back.
During shock. Shock delivered. Provide chest compressions and rescue breaths.
All right. So you all saw how this machine is to be used. We are going to demonstrate it right now. We have Dr. Meenal. So you open the box once it arrives. You will notice inside the box that you're going to have the AED machine. That's the shock box. Now this has been constructed in a very simple fashion where they studied this box, and after it was made so simple that 8-year-olds can actually use it. All right? So I'm sure every adult can easily use this. There should be no reason why you cannot use a shock box. This has been made for people who are non-medicos, people who are non-doctors to actually use this, because what we use in the hospital is a higher version of this, which you've seen in movies, in ICUs. They give a shock with 2 pads. This is a simplified version of that same equipment that we use. Okay, so this is known as an AED. Now it is available in multiple places. Some of the malls have it, theaters have it. Lots of police stations are now started getting it, even in Mumbai. Railway stations have it and airports have it. So next time that you travel, keep your eyes open for it, and you'll be able to see this nice bright red box. Okay, that's usually in another glass chamber, which you need to break and take the AED in case there is a cardiac arrest. All right. So once you open this box, you will realize that there is a scissor inside that has been placed. You did see that they actually undress the victim while they're applying the pads. Now, this has been a major issue when we tried to test this box in India, because nobody really wants to remove your clothes in the middle of the road or in the middle of anywhere. And the clothes that we wear probably are not conducive to applying the pads that are supposed to be applied. So a scissor has been included in it, where you can just make a small hole around here on the right side as well as on the left side. So if the victim is a woman and she's wearing a sari, it becomes very easy because both these areas are actually exposed. But if you're in a shirt or you're in a kurta or you're in any other, this thing, just make a hole here and make a hole here. You don't really need to undress the victim completely. All right? So this is a very small box. It comes with 2 pads. So you open the box, you remove the 2 pads, and you place the pads like you saw in the video. So the first pad is usually placed under the right side collarbone. Okay? So you're going to have 2 pads that are going to come out from the box, and you're going to place these pads, one on the right side under the collarbone that we have. You're going to place it on the right side of the chest, and the second one you're going to place on the left side, right? So we're going to show you how it's done over here.
It comes with the marking. Okay. So one goes on the left side. And the other which goes on the right side, right? Below the collarbone.
Okay, so please remember that you will be giving compressions.
In case of emergency, remove the training cartridge and insert pads cartridge. Press the flashing blue button to choose training scenario. Scenario 1.
Okay.
Scenario 2. Scenario 3. Begin by removing press pads firmly to patient bare skin.
So all the instructions are given by the shock box itself.
Plastic liner is completely removed from both pads. Place the pad exactly as shown in the picture. Pads must not be touching clothing. No one should touch the patient.
Okay?
Analyze.
So what it's doing now is analyzing.
Touch the patient. Analyze. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
So there's an orange button there which is going to constantly keep flashing.
Press the flashing orange button now.
Can you hear that? Press the orange button.
Shock delivered.
And once you press that, it will deliver the shock. Okay?
The ambulance service has been called. It is safe to touch the patient. Start CPR. For help with CPR, press the flashing blue button.
Okay. Off. Okay. So very simple. You will be doing chest compressions. Somebody will arrive with the AED. What you need to do is either cut out holes or open up the shirt. Put on the AED. It'll tell you next what to do. It'll ask you to remove the pads. You remove the pads. You apply one pad on the right side as it is marked on the pad, one pad on the left side, and you wait. It'll ask you to stop compressions so that it can analyze the rhythm. While you're applying the pads, your compressions should continue. You will not take breaks in between at any point of time for the compressions because the blood flow at that point will stop. So do not stop while the pads are being applied. When the machine tells you take a break, wait, let me analyze the rhythm, because it has got a small little brain inside where it picks up the cardiogram and decides whether the heart requires a shock or not. So you technically need to do nothing. The machine will decide for you. So it will tell you, stay clear and analyzing rhythm. At that time, you take your hands off the victim. It will analyze the rhythm and it will tell you it is a shockable rhythm. Okay, so it will tell you press orange button, which is flashing, for delivering the current. Once you deliver the current, okay, it will tell you now it is safe to start the chest compressions again. Okay, no confusion. Lift it up. Okay, so that's the positions of the pads, one just under the collarbone and one on the left side. Okay, once you've given the shock, either again your victim is going to be responsive or the victim is not going to be responsive. If after the shock the victim wakes up, again we need to put the victim, every responsive victim has to be put into what we call as the recovery position. Initially also I told you if the victim has fallen down but is responding to you, you put the victim into a recovery position. So we're going to show you that what that recovery position is very shortly. So once you've started delivered the shock, you start giving the compressions again. If the victim starts responding to you, you will place the victim in a recovery position. If not, you give compressions for 2 minutes again, and then try to re-shock the victim because you have the machine with you. So you keep giving compressions and keep re-shocking the victim till help arrives. Okay? So we're going to show you what the recovery position is. We're going to have Dr. Sajan be the victim, and we'll have Dr. Gauravi put him in the recovery position. So she's going to hold him and roll him over to one side, right? Move the top leg to make sure that it is bent forward for support. Make sure that the lower hand is put under the head, and you're going to keep observing the victim in this position to ensure that the victim is breathing well, and keep talking to the victim at all points of time, right? So that is the recovery position. So when not to start CPR, like I told you, if it's too late by the time you have arrived, and the victim has already gone into rigor mortis, the body has already started becoming stiff, there is no point that, giving CPR at this point is not going to really help the victim. If the patient or the victim is responsive to you, making some sounds, breathing normally, and it's not a cardiac arrest, so you're not going to start CPR. And of course, if you're not safe in that entire area, if you are not safe, please do not risk your life trying to save somebody else. All right, so we'll encapsulate this entire thing in a very nice song which has been made by the Indian Resuscitation Council. One of our own colleagues, anesthesiologist, has actually written the lyrics for this song, and it's been sung. It's available on YouTube as well.
किसी की जिंदगी तुम्हें बचानी है, थमी है दिल की धड़कनें जगानी है, तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार। किसी की जिंदगी तुम्हें बचानी है, थमी है दिल की धड़कनें जगानी है, तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार। शख्स हो कोई किसी भी राह में, आग में या आग में तालाब में, उस जगह से उसको दूर लेना है, क्योंकि खुद को पहले महफूज रखना है। उसे जगह उसे बुलाओ एक बार, कि सांस बंद है क्या देखो मेरे यार, मदद के वास्ते पुकारो जोरदार, 108 डायल करो यार। मिलाओ दोनों हाथों की ये उंगलियां, बीच सीने के रखो हथेलियां, मिलाओ दोनों हाथों की ये उंगलियां, बीच सीने के रखो हथेलियां, दबाओ सीना जोर से बार बार, कि 1 मिनट में सिर्फ 120 बार, कि देखो सीना ऊपर आए हर बार, जीवन संजीवनी दो यार। सीने को दबाना है, दोनों हाथ तुमको सीधे रखना है, 2 इंच सीने को दबाना है, दोनों हाथ तुमको सीधे रखना है, जो थक जाओ तो दूजे को बुलाना है, कि शख्स को जमीन पर ही रखना है, रखना खुद पे और खुदा पे एतबार, एम्बुलेंस आने तक यार, किसी की जिंदगी तुम्हें बचानी है, कमी है दिल की धड़कनें जगानी है, तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार, जीवन संजीवनी दो यार, जीवन संजीवनी दो यार।
So we all know that we've gone through all these steps again. This video is available on YouTube, so if you need to brush up on the knowledge, you can see it and view it anytime, and the more you share it, we are only going to be able to create awareness about this cause and how to save more lives. So our association is, we are part of the Indian Resuscitation Council. We're actually volunteers, all of us do this completely on a voluntary basis. We reach out to schools, colleges mostly. We want this to become a part of the regular curriculum in schools so that, you know, you taught this in school, you don't need to learn about it from another source. And as kids keep passing out of schools and colleges, if we do it for 2 or 3 years, continuously starting from grade 8, I'm sure most of us, when we pass out from school, will know how to save lives. And this will help increase empathy and help us to actually reach out and help victims in cases of accidents and in cases of, you know, any other disasters that are going to be affecting us. So we are very happy that you've actually learned this. Our aim is to train more and more hands so that you are able to save more lives. Thank you.
So some basic questions, you know, this is when you said that there is a heart attack happens and the action to be done. Sometime a person already knows that he is going through a heart attack.
Right.
What should be the line of action for him?
So, you know, we are kind of confusing between a heart attack and a cardiac arrest.
Oh, cardiac arrest.
Okay.
Yes.
So what we've taught you right now is to treat a cardiac arrest.
Got it.
When a heart attack happens, the victim is awake.
Yes.
The victim is having chest pain. The victim is having some pain in his hand, pain in the fingers, pain in the jaw. That's what the victim is going to keep telling you. That's when a heart attack is happening. And what you can do for that person is immediately take that person to a hospital, because there's something known as the golden hour. All right? If you're able to take that person to a hospital and make sure that the adequate medication and the treatment has been started, you're able to prevent that heart attack from becoming worse. Okay? Now, if this goes untreated, the multiple causes, of course, heart attack is one of the causes for a cardiac arrest, but there are multiple causes for cardiac arrest.
Yeah.
If this goes untreated and the victim's heart stops, is when the cardiac arrest is going to begin, and that's when you do this procedure. So a heart attack is completely different from a cardiac arrest.
Got it. Got it. But for you know, people like us, you know, many times we have acidity and you know, reflux, and how a person can differentiate.
Okay, the biggest problem is about differentiating whether it is acidity or whether it is a heart attack that you're having. You're getting discomfort, you're not sure what is happening. You'd rather be safer to err on the fact that it could be a heart attack. Go to the hospital, make sure that a cardiogram is done. If there's nothing on that cardiogram, then you're safe. You treat the acidity, if at all. If not, you are already in the hospital. So you're within that golden hour and you're able to kind of get revascularization done, that angioplasty done as soon as possible, because you have that window of that 1 hour.
Excellent. One more. Now, all of us, me in age of 50 plus, any SOS medicine I should carry along with me?
So for a heart attack, it's safe to carry aspirin and sorbitrate if you have it. Keep it with you. As soon as you feel you're getting pain, you're getting discomfort, you probably have something known as an angina where you have, pain on and off. You probably are already on sorbitrate and aspirin. So just make sure that you chew those tablets, 4 tablets of aspirin, 4 tablets of sorbitrate, chew them and swallow them and take yourself to the hospital.
Any timeline between 2 tablets? Or?
No, you can take them all together.
Okay, nice. One more, all of us have a bad lifestyle, and it's an important that what lifestyle change we should look at to prevent
It's basically live a good stress-free life and you're going to be comfortable. Stress is one of the major causes for heart attacks, as well as then, eventually leading to a cardiac arrest. Because have a happy life. If you're above the age of 40, make sure that you get yourself checked regularly. You make sure that you're getting your lipid profile done, you're making your blood pressure is on check, you're balancing your salt intake, you're making sure that you're eating good, healthy food, adequate fiber and everything. All that will help you to have a healthy lifestyle, and you have a heart healthy life. Technically, it's a heart healthy life, and that's no smoking, limited, very little social alcohol probably, and of course adequate exercise, and keep your heart healthy as possible.
Excellent. So I would 2 things. Would like to invite people to for
yes, absolutely. That's what
demo.
we are here for.
Yes, and also we would like to give a small token of memento to doctors. So
Thank you so much.
Papa, gift up. No, gift up. So all of us will get a certificate. Is that correct? Whoever practices.
Yes.
And invite everyone to join the mat for a practice, and doctors will support you all. Please.
Come down. Thank you so much. Thank you so much. And thank you for having us here so that we can teach everyone. Thank you. We really appreciate it. गौरवी
सोनल बेन का भी ले लो. So I invite everyone to the mat. Yeah.
Yes. Come on, everyone.
5 minutes.
Everybody do it for 1 minute and realize, how to do it. Once you do it on the mannequins, it will be easier for you to help another victim.
एक सेट हो जाता.
Are you okay? Start with hello. Are you all right? Step one is hello. Are you okay? Okay. Look for breathing. Is the victim breathing? Very nice. Check on the stomach. Is the victim breathing? There's no response. You're going to call. Call for help. Call, dial 108. Tell them where you are, how many victims are there. Give them all the information. Identify. You will hang up the phone only when they tell you to. Then you're going to see 2 fingers above the end of the breastbone. Yes, 2 fingers above. And you're going to use the heel of your hand. And you're going to use your shoulders. Yes. Okay? Here. And you're going to use 1 and 2 and 3 and 4 and 5. 11, 12, 13, 14, 15, 16, 17, 4, 5, and 6. Vazan or thoda. It has to be a little depth. Use your shoulders, use your body weight to actually give the compressions. Okay? Continue till the victim responds to you. And one important thing is make sure that the victim is on a hard surface. If you do this on a bed, yeah, it won't be effective because the foam will absorb the pressure. Keep coming. Tap on the shoulders first. Are you okay? Look for the breathing. Any breathing, look at the stomach. Any movements over there? Nothing happening there. 2 fingers above the end of the breastbone. Yeah, yeah. A little higher. See, here you're going to go on the soft part of the tummy. Over here. Yeah. Elbows straight. Elbows absolutely straight. Shoulders on top of the victim. And 1 and 2 and 8. Slow. 9, 10, and 11 and 12. 14, 15, 16, 17, 18, 19. Hmm? 100 to 120 per minute. 5 to 6 centimeters depth.